Hi, I'm Dr. Kate Smith. I'm the principal dentist here at the Dental Lounge at Robina. As dentists, I think we get asked a lot of the same questions fairly frequently, so I thought it would be a good chance to get together my fellow dentists here and we could answer some of those questions for you today. Before we get on to all those questions, I think one thing that I definitely notice for patients, sometimes just making that first step and coming in to see us it seems like it's a big hurdle for a lot of people. Like I think they feel a little bit embarrassed or anxious, and sometimes that seems like it's one of the biggest hurdles for people to, I don't know, come in and see us. What do you guys think?
And people shouldn't be scared, because the first step is coming in and getting that bit of information so you feel comfortable. A lot of the time people have things going on in their mouths that they're not even sure are happening, and it's really important to have someone have a look over that and put together a treatment plan, because dentistry is best when it's preventative.
Yeah. I guess with that, I mean, if we think like there's two main diseases, I suppose, that we're treating on a day in, day out, one being tooth decay, one being gum disease. You know, with gum disease, like it's most of the time it's painless, and so you know, for some people
it's something that happens over many decades and people aren't even aware of it. Normally you only know it's happening in the very late stages when people hit their 50s and 60s, and then by that stage a lot of the time it's often too late. So you know, people will come in and you know, they'll start noticing, you know, that a tooth is getting a bit loose, and you know, by that time
often too late to actually save it. So the best thing, I guess, is coming in early, getting a bit of a plan and doing something to prevent that from happening.
Yeah.
I think lots of people don't realise as well that even as dentists we have our teeth checked at least twice a year and cleaned as well. And as I said before, best thing is preventative dentistry. If you're having everything checked over and cleaned, then if there are any issues, we can address them while they're still small before they become bigger concerns.
And it's not enough just to, you know, brush every day and floss every day, because no matter what, we still get saliva building up, and that is going to get underneath the gums and start to cause that bone loss itself. So I guess, as you said, Caitlin, that's why we actually get our teeth cleaned twice a year as well, despite having good oral hygiene.
Yeah, and also I notice like people who usually come regularly every 6 months, you know, even if there's a problem, it's going to be a very minor problem.
Yeah, absolutely.
And the treatment will even be cheaper, you know, like, when we just leave things for a long time, they just get worse and get much more expensive as well.
Yeah. I think that's probably a common, I don't know, misconception for a lot of patients, is they think, oh, well, it's not hurting right now, I might just leave it and then
see if it goes away.
But they don't, I guess they don't realise that it's just, as time goes on, it's actually getting worse.
And pain is usually just a late sign.
The pain, when the pain's hitting, it's almost too late at that point.
I also find too what you said, Dr. Ma, with pain is a lot of people, once they start to get pain, you know, then they get worried, you know, how painful is it going to be to get it fixed, and what can be done. And there is a lot of fear around pain, particularly if you go back decades ago when pain was definitely a very real thing when you went to the dentist. But you know,
it's much different these days, though. Like,
exactly.
Dentistry changed a lot. Like, and it's definitely not as bad as like decades ago. Like,
absolutely.
Yeah.
You hear some horror stories from.
Oh yeah, tell me about it.
In the past, but
we definitely don't jump on your chest and when we're trying to take a tooth out. That doesn't happen anymore.
I know. I've heard that story so many times. I can't actually imagine.
I can't even imagine doing it.
How anyone could do that.
I'm not that agile.
But seriously, I mean, pain and the fear, I suppose, that's for some people that's built up to the point that it really does stop them seeking help, getting help that they need, which is why, you know, I'm really, really pleased that we're able to offer for, you know, a lot of nervous patients, one, I suppose, a relaxing environment where they can come and have treatment, or and also, you know, with the intravenous sedation that we're able to offer here as well, with the fully qualified anaesthetist that comes in and does it for us. For a lot of people, that fear factor can be removed for them, and they can get the help that they really need.
And especially that usually most people, they find it a very pleasant experience, and they overcome their fear after that, and they feel more confident to go to the dentist. Like I had it so many times that patients, they come in and, you know, and we do Twilight Sedation for them, and then after that they say, no, I don't need it anymore. You know, I feel more confident now.
Yeah, I've definitely had that happen a few times too. Where patients that, I mean, they had to take, you know, they were having to almost sedate themselves just to walk in the door to start with, to turn around and be able to have dental treatment done without anything. Like it's pretty amazing.
I do find I've got a few patients that ask me what actually is intravenous sedation.
Yeah.
Can you talk about it a bit, Kate?
Yeah. So it's it is a little small needle that's put into the arm, and it's a special type of drug that's administered by the anaesthetist that puts people. It's not a full general anaesthetic, so you're not asleep for it. But having said that, a lot of people become so relaxed with it that they do actually drift off to sleep during the procedure. So we can still communicate with you during the procedure, but for a lot of people, they find that it relaxes them so much. We can go on and do the treatment that we need to do, and for the majority of the time, they are actually asleep for it.
Yeah.
You know, but it's not. I mean, I guess it's not suitable for everyone.
Yeah.
So,
and for those who it's not suitable for, we do offer general anaesthetic as well, and that's done in the hospital. Do you want to tell us a bit more about that, Dr. Marr?
As Kate and Caitlin said, like sometimes not every treatment is suitable for IV sedation, but we still can do all the treatment in the hospital under general anaesthetic. Well, they'll be like totally sleeping. Yeah. They wouldn't usually we can do as much work as possible. Just in one visit.
Yes. Yeah.
And I just want to add to what Caitlin said about the Twilight Sedation as well, is that sometimes when I ask my patients, like, you know, how did you find this experience? Was it good or bad? They say, well, look, it does not even exist. Like, I couldn't even remember what happened, which is a really good thing, you know, especially if they were really nervous about that treatment. So whether it's IV sedation or whether it's GA, you know, like usually they will have a good experience.
Yeah. And of course, having, you know, a properly qualified anaesthetist doing the IV sedation and the general sedation, it is very safe as well.
Yeah,
so
true.
It's quite a safe procedure.
Yeah.
And not many practices offer that, right? Like,
no, I think we're the only one on the Gold Coast that offers it with our own in-house anaesthetist. Yeah.
So it makes it a lot easier, you know, for our guests and patients to come in and just have it all done in the one environment, something that's familiar for them.
Well, it removes the cost as well of the day.
Exactly.
The day theatre.
Yeah.
As well. So helps to keep the costs down a little bit. I think another question that probably comes up on a daily basis, I notice, and you guys would too, is, you know, if people that are missing teeth and for whatever reason, you know, people say, well, what can I do? I've got a missing tooth. What am I going to do to replace it?
Yeah.
So
we actually have few options to replace missing teeth, but like the main reason, in my opinion, why replacing teeth is very important is that because once we take a tooth out, what happens is those two teeth on either sides of the gap, they start moving, and they like kind of literally destroy the whole bite, you know. Yeah. And
or you might have a tooth that overgrows from the top and starts hitting the gum on the bottom. That's probably the most difficult area to treat.
Yeah, once it gets to that stage.
Yeah, so, you know, that is why we usually have few options like bridges or implants. The good thing about implants is that we don't have to drill in any of the other teeth, and we just replace that missing tooth that we had to remove earlier. And it is very, very successful, and many people, they love it, you know, like it's usually.
In terms of the recovery, lots of people say as well, it's a lot more comfortable than even after having the tooth itself removed. It's a really speedy and comfortable recovery. Exactly,
and I had that few times, like people, they tell me like it was not as bad as extracting the tooth.
Yeah,
you know?
I hear that all the time.
Yeah. And with all the implants that we did here in the dental lounge, like people did not even get a swelling afterwards or anything, you know, like, it was pretty good.
So for those that don't know, what actually is a dental implant?
A dental implant, you know how like a normal natural tooth has got a root, which is inside the bone, and the crown, which is the part that you see in the mouth. A dental implant is exactly the same. Like it has got a root, but it's made of titanium, which is a very safe material.
Biocompatible.
Biocompatible, yep. And we kind of drill that inside the bone. So it's like a post that we put inside the bone. And then we put a crown on top of that post, which is to replace the part of the tooth that you see inside the mouth.
How long does that process normally take?
Usually it takes around about 4 to 6 months. So once we take the tooth out, we just wait for a couple of months first for that bone to heal. Then we drill a small hole in the bone and put that post in there. We leave it there for a couple of months to heal, and then we put that crown on the top. So it's usually a very simple and efficient process as well. Yeah.
And quite predictable too.
Very predictable,
Yes.
more than any other treatment. Yeah,
Yeah.
it is very, very predictable. Yeah. And people who are not suitable for implants, we still have the bridge option, you know.
Yeah. And bridges are fantastic. If bone is an issue, that's when we tend to go towards bridges. The great thing about bridges is that they're relatively quick to do. So you're probably going to have your bridge within about 2 weeks. And with that, we prepare the tooth, and then we send away, and it takes about a week for that bridge to be made, and then we cement that one in. And it's also quite a predictable process. It just depends on which option suits you best, and we give everybody those options as well.
I think bridges are a great option when the teeth either side of the missing tooth are also very heavily restored.
Yeah, when they need a crown.
And
anyway.
need crowns.
Yeah.
It makes it a really cost-effective and again a predictable way to save those teeth in the long run too.
Yeah, definitely.
And being that they're all made of porcelain and other such materials, they are very safe in the mouth, and they do tend to last quite a while now. So it's a good, I guess, insurance policy for your teeth as well. You know, you're investing in your teeth long term, and you're restoring function as well as aesthetics as well. So it's a good option.
Yeah. Speaking of aesthetics, I guess we definitely get asked a lot about, people say, I don't like the way my teeth look. What can I do to change that or fix it? Or
Yeah, we do hear that a lot. A lot of people
want everything wider and straighter.
Yeah, exactly. And these days, I think with whitening becoming so available, it's become the new norm. Have you found? Yeah. So I find that there's a lot of options in terms of fixing the aesthetics of somebody's smile, both inside the mouth and outside the mouth too. We do have, Kate does fast braces, we do Invisalign, and then we can even talk about, cosmetic veneers, either composite or porcelain. Do you guys find a lot of people don't know the difference? Yeah. So, I mean, it comes down to preference, budget, and your initial dental condition as well as to which way you want to go. But in a nutshell, your composite veneers are essentially a procedure that's done by putting a resin over the front surface of your tooth. So it is a reversible procedure in that it doesn't involve cutting the tooth at all. And it's a way that you can get a relatively cost-effective, quick smile in one procedure. So it is done without any sort of pain, no anaesthetic in most cases, and you can walk away with your new smile that same day. On the flip side, porcelain is going to last you a lot longer, and porcelain reflects the natural tooth a lot better, so it will look a lot more natural than composite veneers. However, I wouldn't say it's a reversible procedure. Once you do the porcelain, that's your new smile for the next few decades in a lot of cases, as long as you can maintain the health of your mouth.
Yeah.
And Kate, you do fast braces, so that's another good way to fix.
I've been really enjoying using that technology in the last few years, which, for people that I suppose, the idea of, with porcelain veneers, it is a permanent procedure. I mean, I myself, I have porcelain veneers on, but for people who have, nice shaped teeth and the teeth just need some rearranging to make them look nice, it's great to be able to straighten the teeth for them with the fast braces, and it's done, most cases are done under a year.
Is it suitable for everyone, Kate?
Look, no, I wouldn't say it was suitable for everyone, but a very high percentage of people it is suitable for. We've had some really great results, some very, very happy patients with
That's good.
their new straight smiles, and and I suppose with it being a little bit faster, the cost of it comes down considerably as well.
And what is the difference between traditional braces and fast braces?
How's it different?
Yes.
Yeah, so with fast braces, because of it's a special patented bracket and wire system, it's designed to start uprighting the roots of the teeth, or straightening the roots of the teeth at the beginning of treatment, as opposed to, I think with traditional braces, it's more about sort of moving the crowns of the teeth around in the first year, and then the second year is spent a bit more uprighting and straightening the roots. So with fast braces, you sort of do both things at the one time.
Simultaneously.
Which is obviously makes it a bit faster. it seems to be a little bit less painful as well than traditional braces, which is nice. And I suppose because the braces are on the teeth for a less amount of time, you do have a decreased risk of some of the other things that can go wrong with normal orthodontic treatment as well, which is good.
And even you do early intervention too with Makeovers?
Yeah. So for younger kids, where we can see that the jaws aren't growing in the way that they should be growing, and I mean, I guess there's a few reasons why that can happen. Probably, I mean, one of the biggest ones is that in our Western society now, unfortunately, we feed our kids have a liking for softer foods. So, you know, several hundred years ago when we ate foods that were a bit rougher and a bit tougher, harder to chew, it actually stimulated our jaws to grow a little bit bigger. So with that, I guess jaws aren't growing quite as big as they should to fit the teeth in. The other one is that a lot of children have become mouth breathers. And it's a well-known fact that if kids are breathing through their mouths, their jaws aren't going to grow in the best way possible. And the other one, which sounds a bit weird, is the swallow habits. So I guess the MyBrace system is looking at trying to correct kids that are breathing through their mouths, so turning them from mouth breathers into nose breathers, and also looking at the habits. It's trying to correct their swallowing habits that are causing teeth to go in the wrong directions as well. So we've seen some really, really great results with that as well.
So it's not just a cosmetic sort of thing, it's a functional thing as well?
No, it's actually firstly more a functional thing, like about health. So you're a healthier person if you're breathing through your nose. So if your nose filters the air and everything, you know, if you're breathing straight in through your mouth, you tend to get sick a bit more often. So it's actually firstly, a health issue. And then the teeth kind of go along for the ride and typically end up a bit straighter along the way as well. So we had some great stories, like little kids that, you know, they've been starting to get picked on at school and things because, you know, maybe their front teeth are sticking out a bit more. You know, they've done only within about 3 months of, you know, wearing the appliance and doing the exercises, they've seen some great changes. I mean, they're not getting picked on anymore in school. Like it's great to be able to help those kids.
And also becoming, you know, a nose breather as opposed to a mouth breather, the kids are going to sleep better at night. They're not going to get sleep apnea. They're going to have better concentration at school in the day.
That's it.
You know, it's just much more well-rounded treatment, I think, if you do catch it early, as opposed to when you do see adults that have the same issue and it wasn't corrected younger. It's a lot harder to fix. And then, you know,
not only that, TMJ problems in adults. TMJ in adults that then, like when they're younger, they can sort of cope with it, but then as they get older and the problem hasn't been corrected, they've got a really chronic problem that they're dealing with for the rest of their life then.
Absolutely.
So
that's a really good point, Anna. And also I get asked a lot about the difference between braces and Invisalign. Like, you know, some people, they say like, I don't like the braces and I just want to have like clear aligners. Would you mind if you tell us more about that?
Yeah, I mean, Anna and I do a bit of Invisalign here. And it's, look, I suppose it's more for the, I don't know, people that are too self-conscious to wear braces. You know, the Invisalign becomes the nicer option for them. They don't want to wear the braces, you know. But I mean, having said that, they usually are in treatment a bit longer.
So than the fast braces, but it is a great option for adults. That, you know, may not want to have fixed braces in all the time. Or the other option is you can take them out for social situations.
And make it easier when you're going out, and also in terms of cleaning, because there's no wires. It's a lot easier to keep your teeth clean.
It's definitely more of an aesthetic or a cosmetic option, I guess, to get your teeth straight. But as Kate said, it does take a little longer. But the technology with Invisalign now is so good that we can get really good results for a lot of cases. Great option.
It's a great option too. I suppose, you know, one I think something that comes up a lot as well with patients is, you know, dental treatment, it's so expensive, you know, I can't afford to do it. And, you know, I understand that, you know, not many people have that amount of money just sitting around, but, you know, I'm really pleased that we're able to offer some payment plan options here for patients.
Dentacare is fantastic.
So, you know, it makes it, you know, people are able to get
and the best
the
part with that
treatment
too
they
is
need.
it's interest free. You know, so it's the same as the big stores, your Harvey Normans, your Domains. You get the product up front, you can pay it off over your terms, which makes it a lot more affordable and achievable. Yeah. And again, in terms of prevention, as you said earlier, Caitlin, means that if you do have a feeling that, you know, is starting to get a bit bigger, you can fix it now before it does become a root canal or an extraction. Yeah, exactly right. So I think it's a great option.
Yeah, it's good.
Coming back to what you said, Kate, with, you know, TMD or a disorder of the actual jaw joint itself, I find that that's a really common thing now. Do you guys?
Yeah, absolutely. Yeah. And it's great that you offer the injections, Dr. Anna, as well, to help with that.
Yeah, so a lot of people don't realise, I guess, that that's an option. Originally, you know, there are many ways you can treat jaw dysfunction or TMD. A really good option is obviously a mouth guard or a splint that you wear at night, which helps to relax the muscles. However, I found myself being a grinder of my own teeth, I would find that didn't quite work enough for me, or I'd spit it out in the middle of the night.
Yeah, lots of people say it ends up in their bottom drawer.
Yeah, exactly. So for those that it may not be as suitable for, we actually offer muscle relaxing injections actually into the muscles themselves. You do have to keep on top of them every few months. However, it's a really quick and affordable procedure where you don't have to worry about putting anything in your mouth at night. It's just done in the chair and the muscles relax. It really gives people a lot of relief, particularly those that suffer headaches constantly, those that are grinding their teeth down, because as we know that starts to get tricky to fix as well long term. So if we can get in early and just relax those jaw muscles, I found for myself that's helped massively. And now I only need to do it once a year. So that's quite good.
Yep. Yeah. Wow, that's good.
I mean, it's a therapeutic use of the muscle relaxing injections. However, we do offer cosmetic uses of it as well. So again, when I talk about smile makeovers, we do your porcelain veneers, we do your fast braces, Invisalign.
Zoom whitening.
Whitening, yeah, absolutely. And it's really nice to, I think, address the whole face, not just the teeth.
Yeah.
So I find a lot of people, for example, have a gummy smile. You know, they smile and they show a lot of gum. We can actually use muscle injections to drop the top lip and just make a much more aesthetically pleasing smile.
After all, the lips are what frame the mouth and the smile.
Exactly,
it's important to think about everything.
Yeah, so we do it. A lot of people don't realise, I guess, as dentists that we offer that, but when you think about it, we're really specialists of head and neck anatomy. So we're kind of the best people, in my opinion, to treat it, because we deal with it all day, every day, with extractions, with injections. I think we keep our knowledge really current of head and neck anatomy for that reason.
Yeah.
Another reason why you sometimes might get jaw pain as well is wisdom teeth. Can you tell us a bit more about that, Dr. Mark?
Yeah. You know when do you know, Kate, when you were talking about like how we eat soft food all the time now, and that's why the jaw is not growing?
Yes.
That's also one of the reasons why the wisdom teeth, they don't show up like ages ago.
They get stuck.
Ages ago, like, you know, when people were eating like more raw food and their jaws used to grow, and when they grow, the wisdom teeth will show up normally. But these days, with all the soft food that we eat, like usually the jaws, they don't grow, and that's why the wisdom teeth, they get stuck under the bone. Yeah. The problem is all the food, it just gets stuck under the gum, and it causes like constant pain all the time. It's impossible to clean.
Sometimes you may not even get pain. Sometimes people have wisdom teeth and they're decaying, and sometimes they can even be causing a decay on the tooth in front, and it's important for them to be removed, but you're not even aware of it. So.
So like what we do here is we remove most of the wisdom teeth as well. Like, you know, it is a very common problem, as you said, and and we do that all the time.
As you said, Caitlin and Ma as well, when the bacteria is getting underneath the gum, that's getting into our blood systems too. And causing other issues. Or that bacteria we find in the mouth shows up other places, like in the heart and in the brain as well. So there is a correlation between it. So it's good to treat it early as opposed to leaving it a long time and it does become an issue.
Yeah, I usually try to recommend to my patients, get it done when you're young, rather than to get it done when you're old, when, you know, when the healing's
a lot better.
Yeah.
And what you were saying before about bacteria getting under the gums, that's why oral hygiene at home is really important as well. Lots of people think that even brushing twice a day is enough, and it's just not. The toothbrush doesn't get in underneath the gums, it doesn't get in between the teeth, so it's important for people to to be flossing as well. And as we mentioned earlier as well, having those 6 monthly cleans, because even if you've got perfect oral hygiene, you will still get a little bit of mineral buildup, and that mineral buildup contains bacteria, and when it sits on the teeth, it causes an inflammatory reaction with your body, and over time, basically, if your gums are bleeding, it means that gum and bone is breaking down. Lots of people who come in, they say, I don't floss because my gums bleed when I do. And I always say to people, you know, if you're seeing bleeding, that's a little red flag from your body saying that you actually need to clean that area, not avoid it. So it's really important, brushing twice a day, flossing once, and having your 6 monthly cleans.
Yeah, and flossing's so important too, because each tooth is made up of 5 surfaces essentially, and brushing only gets the front, the top, and the inside, and so you're missing 2 whole surfaces. That's if you're not flossing.
Almost half of your tooth that you're not cleaning there.
Exactly. So,
actually, what I found myself is I try to make it as part of as a habit. Like, you know, otherwise I'll just forget to floss. So what I do is I just brush my teeth before I go to bed and just floss at the same time. So if I forgot at that time, I'm like, there is something missing. I need to floss.
I agree. Do you know, I even floss first. Because then I want to brush. So I floss first, and then you get a nice minty fresh feeling after brushing your teeth too, so then it's definitely done. You're not going to make an excuse not to do it.
Totally.
But we find that the people who do floss, they are the people that have the least dental work that needs to be done, and they just have the best outcomes. And even in terms of, you know, preventing further work to be done, it's not even just that. Also, any dental work that you do get done, like fillings, crowns, things like that, all of that will last a whole lot longer if you are flossing your teeth and keeping up with your oral hygiene. Another thing that I often hear from patients is they've said, I've got a crown on my tooth, it therefore doesn't attract any plaque on it, I don't need to have it cleaned. But what people don't realise is that that crown is still sitting on tooth structure. Even if that tooth structure is under the gum and you can't see it, the bacteria can still attach to it. So it's really important to keep everything clean.
What about bridges? How do you guys think what do you think the best way to clean bridges are? Because I get that
Either with Superfloss or Pixters, I find. Superfloss is probably the best, but most people struggle using it. If it's at the front, Superfloss is wonderful because it is a bit easier to get that in. Superfloss is like normal floss, except it's a little bit spongier, and it has a sort of stiff tip on it, so you can thread it underneath the bridge there. But for back teeth, Pixters are wonderful. And even if you're finding that you've got some bigger gaps between your teeth, sometimes Pixters are a great option, as well as using your floss there.
Yeah, that is true. And it's also important to floss implants as well.
Oh,
even
yeah.
though it's not tooth structure, it still will.
We'll treat them as normal teeth, you know, like, you just floss normally around them. Actually, if you do not floss around them, you know how you can get like normal gum disease around the teeth? You can get gum disease around the implant as well. So it's, you know,
really important.
It is.
I think the overall thing is dentistry is preventative. In terms of tooth decay, gum disease, lots of people think they're just a part of life. They're not. If you keep on top of everything, there's absolutely no reason why you shouldn't have to have extensive work. It should really just be a check, a clean, maybe a little filling or two here and there. But yeah, as I said before, the people with the best outcomes are those who have the best oral hygiene.
And it's like anything, maintenance. You know, you take your car every 6 months to get
everything
clean your house every week. You know, same thing with your teeth. My favourite thing in life is food. So for me, it's so important to keep my teeth.
Speaking of that, you know, a lot of people say to me, you know, I brush my teeth, I floss my teeth all the time. Why am I still getting all these cavities? And what we're putting so what we're putting in our mouths all the time, both drinking and eating, is huge as well.
One of the biggest issues that I find when parents come in as well these days is, particularly as they're trying to keep their kids away from lollies and chocolate and things like that, they're having a lot more fruit and a lot more fruit juice as well. One of the biggest things that I tell parents is even if you squeeze that juice at home, it still has sugar and it still has acid in it, and that will break down the teeth as well. Another one for people to be aware of as well is soda water or sparkling water, or even just normal water with lemon in it as well. So I only say to people on a weekday, just plain water, and on the weekends you can treat yourself then. But really important to stick to plain water throughout the weeks for both adults and children as well.
Yeah, that's true.
I suppose the other piece of the puzzle too that I see with patients who say, you know, who then say, you know, I brush, I floss, I don't eat any junk food, and I still have decay. The other piece of that puzzle I find is their own defences, which is saliva, which I know sounds weird, but saliva is our own
liquid gold.
Yeah, it's our own teeth's natural defence. So some people actually do have like a disease of their saliva where the saliva is not doing its job properly, and for those people, that's why it's extra important for them to be getting in more often to have their teeth checked.
Absolutely.
Because they're at a much, much higher risk of having dental diseases. So, yeah. We think of, patients that we see maybe that have either have an actual disease in their saliva glands, or they've just had some radiation treatment for cancer and things like that. I mean, when you knock out those saliva glands, the teeth, they get so much damage just in such a short amount of time too. So it just highlights again.
When we can identify that, we can help you change your toothpaste. There's a particular product called Nutriflor, which is really, really good.
Tooth mousse is great.
Yeah, tooth mousse as well.
Yeah.
And all those products really help to strengthen your saliva and help repair some of those areas that are starting to break down.
Do you guys ever get questions about why X-ray is so important?
Lots of people come in. I think most people expect that we can see everywhere in your mouth. But what people don't realise is right where your teeth join together, we physically can't see that area, and that's the area that most of your plaque sits. So it's really important to have a look at there, because often a area of decay can be starting, and the only time that you can actually see it through the top of the tooth is often when it's too late, because it's got to the stage where it's so large that it's broken through the top of the tooth. But again, if we take X-rays, we can catch things when they're early.
And a lot of people are a bit worried about radiation, but these days it's dental
so
X-ray is so good.
One of the little X-rays that we take inside your mouth is the equivalent to 1 hour of sunlight.
Exactly. And the other thing I've heard is you actually get more radiation from standing next to a bunch of bananas in your kitchen.
Oh, really?
So there you go. Than a dental X-ray. So they are really safe, and the best way, again, is preventative, to find something when it's small, and we can fix it when it's just a little filling. It's going to last you a lot longer than a larger filling that may need further work.
We also take full head X-rays as part of our new patient special as standard, and that's really good to have a look at all the roots of the teeth, the sinuses, the jaw joints, and just make sure that there's nothing happening in the jaws that we can't again physically see ourselves. And again, in terms of the dosage of radiation, it's the equivalent of having a flight over to Europe. So lots of people have been on a plane before. So it's, in terms of X-rays, there's something that once upon a time they were something that you had to be really, cautious of. But these days they're very safe, and they're part of a really good preventative plan for your teeth.
And it gives us something, every time we see our patients, every 6 months or so, we've got an initial basis to work back from and see what is changing.
Well, that's why the photos we take are so important as
well.
well.
Like you get people saying, why are you taking photos of my teeth? But it's such a useful tool. Like, I can't tell you guys how many times I've looked back at those photos we've taken, and you can see, is the wear changing? Is something, does this look the same?
Moving?
It's really great
So you take
information.
them to keep them as a baseline record.
Absolutely.
Like something to compare to in the future.
And as well, we can show our patients as well what's going on inside their mouths too. It's really useful.
Yeah, I agree. I guess with that too, it's a really good idea to keep coming to the same dentist, because we do have an initial record to follow up from. If you go somewhere else, they may not know that there's perhaps a crack in a tooth. It's been like that for decades, and they might want to crown it or do a filling or something, and you may not necessarily need it. So if you keep going to your same dentist and following up, then we can make a long-term plan for you and your family.
Care.
Exactly.
Sure. So now, we were running a Facebook post about ask a question. So I think Eden is going to come on and read the winner's question out to us, and we're going to answer it.
Hello, Eden.
So Monica won our Facebook competition for our Ask a Question for the dentist, and her question was, why won't Rob the dentist ever show his face on TV? Is he long in the tooth? But her more appropriate question is, why do some antibiotic medications turn your teeth brown?
That's a good question. So I guess the one that comes to my mind would be tetracycline. You guys are probably thinking of that one too.
An antibiotic.
An antibiotic. And if it is taken during the time that teeth are developing in the jaws,
while you're pregnant,
Yeah, from when you're
Yeah.
pregnant through to, you know, when you're a kid
Yeah.
and the teeth are developing up in your jaws. My understanding is that the tetracycline bonds to the calcium in our teeth as it's forming. And then when the tooth comes up and is exposed into the mouth and it's exposed to light, the tetracycline actually becomes oxidized and it goes from sort of a yellow, changes colour, it goes from a yellow to a brown colour. So it's got to do with the actual drug being taken up by the tooth as it's forming. And so when it comes up, it, unfortunately it oxidizes and turns brown, a bit like, you know, a nail gets rusty and brown. So that's an oxidizing reaction as well.
Does it just happen with tetracycline or with any other antibiotic?
I think tetracycline's the main one. I think a few in that category, like maybe doxycycline
Yeah.
as well. So yeah, I think that to some degree it may do it with that as well.
Yeah, I think many doctors are aware of that as well.
Yeah,
They don't
so it
prescribe
doesn't. Yeah, so it's
tetracycline
not
for-
seen so much now because it's doctors are sort of aware of it now. But back in the day when it was like one of the best antibiotics around, broad spectrum wise, it was used a lot, and so unfortunately there's a few people that got that sort of reaction
And
from
what was
it.
the other part of the question? Rob the dentist?
Yes, Rob
On the ads?
dentist. Is he long in the tooth? How does he show his face?
I don't know. My understanding of that is quite some time ago, dentists weren't actually able to advertise.
Yeah.
It was actually illegal for dental practices or dentists to advertise. So as a result, you know, the ads were there to try and promote awareness and oral hygiene and had to come from a dentist, but dentists weren't allowed to advertise. They hid his face. He may be long in the tooth. I'm not sure.
And maybe he was long in the tooth, perhaps.
Well, thank you very much, Monica, for your question.
Thank
Monica.
you. And thanks, Eden.
Great. Okay, well, thanks for watching our little question and answer session. I hope you found it informative. If you have any other questions for us, please feel free to send them through to us and we'll hopefully be answering some of them maybe once a week or something like that. And that's it for today. Thank you.